Welcome to Trend Savvy RX. We're here to elevate your pharmacy into a trend savvy health and wellness profit center. So, what do we know? 82% of US consumers now consider wellness a top and important priority in their everyday lives. In the US alone, the wellness market has reached 480 billion, growing at 5 to 10% per year. If you're not involved in this market, you're missing out on a thriving industry with immense potential. And the only way to innovate is to lead the charge in change. Wellness must be a big part of your profession as we move forward. Wellness is different from healthcare. Our healthcare system uses a pathogenic and reactive approach focused on cause, consequences, diagnosis, and treatment of disease and injuries. In contrast, wellness is a salutogenic and a proactive approach focused on prevention, healthy lifestyles, and the pursuit of optimal wellness. Imagine the transformative power of pharmacist driven, natural complementary support and education. Imagine if a pharmacist, utilizing their expertise, could help a patient improve vitals, lower the need for anti inflammatories, reduce sugar levels, lessen the potential for infection, offset the side effects of their prescription drug, or even reduce the need for pain medication post surgery through more natural complementary support. Now consider another case in which every time an antibiotic is prescribed or recommended, a probiotic and brief explanation on the importance of healthy gut bacteria was provided. That's an instant sale. Hi, I'm Radia Glees. Thank you for joining me. I'm a board certified clinical nutritionist, biochemical analyst, and I've been a holistic practitioner for over 35 years. I was a wellness counselor for People's Pharmacy for 4 years before I was hired to open the wellness department for Martin's Pharmacies, both Lamar Plaza Drugstore and Dripping Springs Pharmacy, before I became the wellness director for Lick Hills Pharmacy for over 9 years. So let's hear what Jim Martin has to say.
Several years ago, we decided to add pharmaceutical-grade supplements to our offerings in our three pharmacies in Austin, Texas. Not having a lot of experience with supplements, we brought in Radia Glees, who has a world of knowledge about all kinds of supplements and how to sell them to consumers. This was the best decision we made, and it enabled us to put the right products in stock and utilize Radia's knowledge to jumpstart our new program. With a margin of approximately 50%, this has been a lifesaver to our pharmacies as we have become known as the go-to destination for supplements in the three areas we serve. Radia is now in a position to help other pharmacies, and I would recommend speaking to her about how she might help you as you consider offering high-quality products in your pharmacy.
So, what is the role of today's pharmacist in healthcare? Doctors often send patients to a pharmacist to seek information on the kind of products available. Yet, academic pharmacy's primary focus is on drugs and disease, with limited instruction in the area of wellness. It's time for pharmacies to step up and take a leadership role in enhancing the wellness of Americans. Pharmacists can participate in both sides of a drugstore. They can play a pivotal role when prescription drugs and dietary supplements are integrated. Introducing the Trend Savvy RX online course. It offers a comprehensive online training program that assists in the seamless integration of wellness departments into existing pharmacy infrastructure, including customized wellness plans that pharmacies can offer to their patients, emphasizing preventative care and holistic health approaches. With minimal to no investment in inventory, no additional education needed beyond this course, and little or no additional staff. Okay, based on the survey that some of you filled out, here was the majority of responses to the question, well, why are you here in the first place? 78% of you said, I want to help people get well. Complementary medicine is the perfect combination. So here's my story. My first degree was at Art Center College of Design in Pasadena, California. I was an illustration major, although technically I was an airbrush artist. So when I got out of school, I was hired by Disney and I was one of the designers on Epcot at the time. And I was in my early 30s and I felt awful. I had all kinds of problems. I had weight problems, I had migraine headaches, I had allergies, but most importantly, I had heart palpitations. So I went to my family doctor, who happened to be the chief cardiologist for Santa Monica Hospital, and he put me on phenobarbital. Well, that took care of my heart rate. I barely had a heartbeat. And I'm thinking, I can't do this. This is highly addictive, and I don't feel any better. So I found a nutritionist down in Malibu. Now, in those days, that was few and far between, but she was amazing and she changed my life. So she's taking my history. She says, "So it says here you're an airbrush artist." Yes. "Well, didn't you wear a mask?" Of course, it never occurred to me that blowing rainbows out of my nose was a bad thing. So I said, "A mask? No. How could I smoke?" Okay. So she said, "Do you drink coffee?" I said, "Yeah." She said, "How much?" I said, "About 6 cups." Hmm. I come to find out 20 years later that I've got the genetic SNP, the CYP1A2, where I'm a slow metabolizer of caffeine. So apparently, I wasn't phenobarbital deficient. So I was so inspired by this woman. I said, people need to know this stuff. So I went back to school and became a certified clinical nutritionist. And the rest is history. Now, 57% of you said, "I like to work directly with patients." Work holistically. The reason for the 53 five-star reviews at Lake Hills Pharmacy is because we get to know our patients and they feel truly cared for and they stay loyal because of it.
42.9% said, "I believe that working as a pharmacist can be financially rewarding. Even better with complementary revenue. At the peak of my tenure at Lake Hills Pharmacy, I was generating between $90,000 and $100,000 in monthly sales of medical grade nutraceuticals for the pharmacy. This would have been lost revenue if they hadn't added a wellness component." 35% said, "I want to be an important member of the healthcare team." Your job can be more than just filling prescriptions. This is a great role for pharmacists because you're the most accessible medical professionals and the public respects your medical opinion.
Okay, consider a scenario where a pharmacist wants to offer more holistic care but faces a roadblock due to a lack of knowledge about nutraceuticals. They might think that implementing such a program requires intensive additional education or significant investment in new inventory. My course dispels these myths by showing you how you can leverage existing resources and knowledge to create impactful changes. Through simple, clear, and effective strategies, I remove the roadblocks to integrating nutraceuticals into your practice. So, what stands in your way of incorporating a wellness component in your pharmacy? 35% said, "I have no knowledge of the subject." With 35 years of experience, I can streamline your learning and teach you everything you need to know in an 8-module self-paced course. 35% said, "I worry about cost and time." In addition to what you will learn, the course includes a free ebook on functional medicine fundamentals for professionals and an Excel spreadsheet for quick references on drug-induced nutrient depletion, including my recommendations for the most appropriate and cost-effective supplements. 21.8% said keeping patients safe while fighting to get through a dangerously high workload. Even if you use nothing but the drug-induced nutrient depletion tool provided in this course, you'll keep your patients safer and reduce side effects while increasing your revenue. 35% said, "I have limited staff and budget." I'll provide the pros and cons of in-store inventory versus a virtual dispensary and guide you on how to use each effectively. as well as discuss alternative remote collaboration options available.
So let's talk about the course focus. One, introduction to the world of complementary pharmaceutical nutraceutical wellness and market trends. Two, in-depth training on the fundamentals of complementary wellness, including professional grade nutraceutical nutritional supplements versus commercial grade supplements. Three, using my 35 years experience with professional supplement manufacturers to teach you where and how to buy the best professional products tailored specifically to your pharmacy and which of these products are best to have on your shelf or in your virtual dispensary. Four, pros and cons of in-store inventory and virtual dispensaries and how and when to use them. Five, an overview of my consumer-based preventative health strategies ebook, The Real Six Pillars of Health, with an accompanying manual to be used by you, the professional, as a guide for supplement recommendations. Six, how to use my indispensable drug-induced nutrient depletion tool included in this course. Seven, integration of wellness departments into existing pharmacy infrastructures, focusing on service offerings and staff training. And eight, don't want to educate, hire new staff, or stock shelves? This module covers the various collaboration options available to you.
My goal is to empower pharmacists with the knowledge and tools needed to integrate complementary nutraceuticals into their practice. I want to teach the teachers to help improve patients' outcome and enhance the role of pharmacies in community health. My course aims to address the common challenges faced by independent pharmacies by providing practical, effective solutions. Are you ready to take your pharmacy to the next level and boost your revenue without a major investment or years of additional college education? Why wait? Transform your pharmacy's bottom line starting today.